So I started with Breastlink right before the pandemic started, or at least officially started. I think by now we know it started a little sooner than March. Dr. Bonev joined the practice several months later in November. One of the biggest challenges has been finding a way to make patients feel safe during this time and still being able to provide quality care. So I think we've done that pretty well at Breastlink, with being able to make sure that everything is in place to provide a very safe environment for our patients, and so that there's no risk for them getting any disease that they don't want, such as COVID-19. How was your experience been since you came in the middle of the pandemic pretty much?
Right, which is not the most ideal situation, and for you also working during the pandemic is obviously tough, but it's sad, but it's become our new normal right now. But at least I can say we have still been doing everything we would normally be doing for a patient, making sure they're getting timely diagnosis, timely treatment for them. And then of course we are doing our cleaning protocols, making sure everyone is safe for us and the patients and the staff as well. But we're still offering the highest quality of care for our patients.
And she brings a good point. We're trying to not only keep the patients safe, but our staff safe as well. Everyone that's at our facilities, obviously they want to be safe too. So it's important that our patients understand that we take that very seriously. And I think this is a good point to bring up our VirtualLink services. We have, like many institutions, many organizations across the country, have started to implement virtual care, virtual visit options. And we have our own version of that, which we call VirtualLink. And that allows our patients to connect with us virtually. Some patients won't have the ability necessarily to come see us in person for a number of reasons. And we can offer those patients a virtual visit. And majority of what we would need to discuss with the patient can be done without the physical exam. Of course, no visit is complete without a physical exam. However, I feel that there are some patients that can benefit from that consultation prior to the exam, such as patients that may be in remote locations or far from us. We can at least help them understand what's going on with their diagnosis, at least give them some options so that they can at least process that information. And if they do decide to come see us, then we can get them in the office and do a physical exam.
Right, and that's the great thing about the VirtualLink program, is that we can see patients from all over.
Right.
They can be in the same state, they can be in a different state, it doesn't matter, and we can still offer them second opinions, first opinions, and if they choose to stay with us, great. If they don't, totally fine, we're absolutely available. But I think it's so great that we can offer that care extended to patients who maybe wouldn't have known about us, and get that good access to appropriate treatment.
Yeah, absolutely. And anecdotally speaking, I have patients that are driving in to see me from Arizona, Nevada, Temecula. And sometimes they ask me, hey, can we maybe just do this visit over the phone or Zoom? And of course, we'd like to also offer our patients physical exam, but of course, sometimes that may not be feasible for them. And some issues can be discussed on the phone, and we're happy to at least offer that.
Yeah, phone, video visits, whatever works out for patients.
Right.
Computer, phone, it's okay. Yeah.